the NHS is in imminent danger of being handed over to American corporations. And what that means to you and me is relatives, friends will be dying or getting harmed preventably simply because an insurance company has decided it doesn't want to pay for their care. The power of doctors and nurses within the NHS to decide and make sure you get the treatment you need is being removed. The NHS bill will convert our NHS into an American-style managed care system where profit will be maximised by denying patients care. I've been to America, I've studied their system, and it abandons people when they're at their most vulnerable. Michael Moore made a documentary called Sicko about not the people who don't have insurance, but about the people who do have insurance and how badly they are treated.
I got cervical cancer and I was denied through the insurance company. They said, we're not paying for it because you're 22 and you shouldn't be having cervical cancer. You're too young.
The number one cause of household bankruptcy in America is medical bills, and most of those people going bankrupt had insurance.
Larry had a heart attack, and then Donna got cancer. And even though they had health insurance, the co-pays and deductibles soon added up to the point where they could no longer afford to keep their home.
So private health insurance is no protection. Those people who are not within the system go without care, or as I witnessed myself, queue up in the middle of the night for volunteer services provided by charities. That's the future we are all facing. Now we know the American system is twice as expensive as what we spend on healthcare in this country. It delivers worse outcomes. The third cause of death in hospitals is medical error. So our government has decided to copy this totally dysfunctional, endemically fraudulent and hugely expensive system. It's difficult to understand why. Some of it is based on ideology, but we know from recent contracts relating to the coronavirus, there is a financial self-interest with many of our politicians. We've seen that with Tony Blair. We've also seen that with Nick Clegg, who now works with Facebook. So David Cameron, we know, for his work with Greensill, was being paid $1 million per year for a part-time job providing access to Westminster and Downing Street. Nobody ever voted for the NHS to be privatised. Our politicians are constantly lying to us about how they value the NHS.
We've tried to give the NHS as much as we possibly can.
There's not a week that goes by when I don't see the effects of declining services affecting my patients. The health bill that's before Parliament now is the culmination of a 4-decade-long stealth attack on the NHS. This began under Margaret Thatcher. The policy document was produced by MPs Oliver Letwin and John Redwood in 1988, called Britain's Biggest Enterprise, and they set out in that document how they wanted to transform the NHS into a private insurance system like the American system without people noticing. We had the toxic debt burden through private finance initiative. For the first time in the early 2000s, the outsourcing of medical services by the Tony Blair government, and under the Blair government they introduced something called world-class commissioning. And what that did was introduce large corporations such as McKinsey, the Big Four accountancy firms, United Health, the insurer, to provide support for the NHS to commission services. And what the Health Bill 2021 will do is finally legitimise changes that have been going on behind the surface, where these corporations will be given legal footing to take control of the budgets. In particular, the company United Health with its subsidiary Optum in control.
United Healthcare Medicare Advantage plans have so much to take advantage of.
Mama, go.
United Healthcare can help you avoid financial surprises by helping you compare costs and doctor quality ratings.
They have a presence across the world. Not only have they had their ex-president of global expansion, Simon Stevens, running the NHS since 2014. Indeed, back in 2012, Simon Stevens was advocating that a solution to all developed world's health problems was to copy the American system. But behind the scenes, they've also been hired using their UK subsidiary Optum to train and brainwash leaders within the NHS and local councils in the ways of managed care.
We're honored to have you as a member, and we're committed to making sure that your experience with us is a great one.
The private sector in the NHS, we saw with the company Carillion going bust. They were a major outsourcer of services to hospitals. They were effectively running a Ponzi scheme, underbidding for contracts. They left with £8 billion hole in their finances, which the taxpayer has had to pick up. Vanguard Health, which a few years ago had such an atrocious record with cataract surgery that up to 50% of the patients they were dealing with had complications. They walked away from their contract, and again the taxpayer and the NHS was left to pick up the pieces. We know that healthcare is best delivered by the public sector, paid through by tax. First of all, it's far more efficient. You don't need a parallel structure of bureaucracy for collecting fees. Secondly, everybody is entitled to care, irrespective of their ability to pay when they need care. There is no privatized system in the world that delivers care for those who can't afford it. In America, their system is failing.
Individuals have left a patient half naked on the city streets, and it's about 30 degrees.
And the last thing England needs to do is to copy that failure. The most important thing we can do is to raise awareness of what's actually going on. Without grassroots pressure, we're going to lose the NHS. We can't rely on our politicians. They need to be pressurized into doing the right thing. This is a fight for our democracy. Do we want our lives ruled by corporations with the power to deny us healthcare? Or do we want a democracy where the politicians ask and respect our wishes? We need to rediscover that spirit of fighting for our rights and insisting that the NHS is restored to a proper public service, renationalised, and no longer being used as a profit stream for private companies. It's very important people get behind Double Down News and independent media, because mainstream media is totally failing to tell the public what's really going on. So please subscribe to Double Down News Patreon, give them what support you can afford, and thank you very much.